most famous physical therapist on the internet.
Welcome, my friends, to the Bob and Brad podcast, produced by Bob and Brad, the two most famous physical therapists on the internet.
In your opinion, of course.
And our opinion, exactly right, Chris. I'm Brad, and I'm exactly one half of the Bob and Brad team. And we are fortunate enough to have Chris the Pharmacist join us today. And we're going to talk about, do muscle relaxers stop pain, and how do they work, and answers to common questions and concerns. And Chris does an excellent job of talking and giving you good layman's explanations. These are questions that when you leave the doctor or the pharmacist, you'd say, geez, I wish I would have asked this question or that question about the medication. So Chris gets 30 seconds per customer, right? Or roughly, because there's a big line.
Oh, yeah, it seems like it.
Yeah, and we're going to take much longer than that. So this is a really good culmination of information for you. So are we ready, Chris?
I think we're ready to
Tanner,
rock and roll.
are we ready? Okay.
All right.
The medication is muscle relaxers. Now that covers a whole.
Yeah, there's a whole bridge of. I mean, there's several of them that we use. So I mean,
is there any one that's most common, or?
Yeah, I'd say probably cyclobenzaprine is probably the most common.
Say that again.
Cyclobenzaprine.
Okay. Benzoyl, yeah. They always have these big words on there.
We don't get out of school till we say each name five times fast. I mean, it's just, you got to rattle it off. Otherwise, They don't give you your degree.
Yep, I understand. I just want to make sure that the listeners, get a hold of it.
Yep.
So that's one of the more popular,
I would say that's
common ones.
Yeah, it's one of the more common ones that I see. I mean, you're going to see methylcarbamol, metaxalone. You'll see tizanidine. You'll see baclofen. Some cases you'll see diazepam, actually. So there's a lot of different reasons why they'll prescribe different ones. The one that carisoprodol, we can talk about that because that's addictive. So
okay.
Yeah, so we'll make a side note on that one.
Cover this. So let's go back to muscle relaxers, and it's like the title says, do they stop pain? So what's the most commonly prescribed reason for a muscle relaxer?
Yeah, well, I mean, the general term is going to be a muscle spasm, and so this, we're walking right into the hallmark of your arena, I think. And so when people come in, it can be for a variety of different reasons. So let's say you have a patient that's suffering from fibromyalgia and they have real tight, painful muscles.
Sure.
It could be just a back strain, a neck strain. Maybe they were in a car accident, weekend warrior project.
Yep.
I mean, so there's a lot of reasons why our muscles go into a spasm or very tight.
And then when they go in that tight spasm, pain is
hurts.
Associated with
it. It's a bad
it.
day. I mean, it can screw up your posture. I mean, you can't stand up straight maybe
Right.
if you have something. Like, I mean, personally, I've had, problems with L4 and L5 in my spine.
Mm-hmm.
And I've had points where I C for Chris, and I also look like the letter C because I was hunched over like a, a little.
That's not funny, but you did a good job.
But I mean, it can hurt quite a bit, and so it's going to be ER urgent care visit in a lot of cases. You usually aren't going to have time to. I'd like to schedule an appointment with Dr. Smith today. I'm really in a lot of pain.
They'll call
you're going to go in. It's going to be an urgent situation. Yeah. And, interestingly, the mainstays, and a lot of people will try Tylenol or ibuprofen or Aleve because those are kind of the mainstays of therapy at first. Because they help with the pain. And the first thing that people are, gosh, they're uncomfortable. And when they come in to see me, they're having trouble walking back to the pharmacy. They're, maybe not real comfortable at the counter. So you can see that it's definitely affecting them. And so
I just want to don't skip the point of, why do these muscles, we have an injury, why do they contract and spasm and cause more pain? It doesn't make sense.
Yeah, I mean, it's a whole complex cavalcade of events that go on to lead to that point. I mean, really, in a lot of cases, spasming really is kind of trying to act as a protective mechanism. Your body recognized something wasn't right, so they're trying to correct it.
So it's actually, and I knew this, but I still want to make sure that the viewers understand the muscles are contracting around the injury to splint it, to keep it from moving and protect it, but they over spasm, and once a muscle contracts that tight for so long, it becomes very painful because we get the lactic acid buildup. We don't have circulation, and it's a compounding thing.
and it is. And like you say, it's kind of like that proverbial snowball rolling downhill. The problem, it might be, it's kind of funny. Sometimes these injuries, it's kind of mild, and all of a sudden it's like, ooh, and then later all of a sudden you kind of cool off, and you're like, oh, this is not good.
Sure. Yep.
And so they go in and they see the doctor, and interesting. So they come in, and we'll just pick on cyclobenzaprine for starters.
Sure.
We'll just take that one, and so they'll come and see me. and usually it's dosed as a 5 or a 10 milligram tablet,
Sure.
and usually anywhere from, it can be dosed up to 3 times a day, most commonly because the biggest side effect of these things is sedation, and that's probably why it works. I mean, when these muscles are really tight and hammered on like that, where they just don't want to relax, basically it's not fully understood by any one of the muscle relaxants that we prescribe, but we just know that it works in a central, so it works on the spinal system, it works centrally, except for the one that's called dantrolene, which is the only peripheral one other than like Botox, but we aren't going to talk about those. Yeah. But they kind of help to just relax the whole central nervous system. It kind of calms down all that conduction velocity with the nerve, all the fancy stuff that kind of goes on.
So in other words, it's telling the muscle to relax, but it doesn't just tell the tight muscles to relax. It
relaxes all skeletal muscle. Okay. So, I mean, let's say you got a back problem. I mean, you could, and that's one of the problems, especially as we age too, that these effects can be much compounded. And there's this fancy drug list called the Beers list, which are drugs that we would call inappropriate for people over the age of 65.
Beers?
Beers, just like we're drinking beers, but the Beers list. It's named after a physician.
So you can go online and find this?
Yeah, you really can. And actually, it's a very important topic for pharmacists because we deal with this quite a bit.
Sure.
Because we know the age of everybody that's coming in, so we're going to say, oh, you got cyclobenzaprine, Mrs. Smith, and I see you're 68 years old. You need to be very cautious with this because it's going to make you very tired. Okay. Now, a lot of times doctors recognize fully that these drugs are on the Beers list, but there really aren't a lot of other choices. I mean, so they'll go with a lower dose, and then what we do as pharmacists, hey, you need to be careful with driving. You should not be driving. You should not be drinking alcohol with these products. Mm-hmm. You need to know exactly how you're going to respond. I wouldn't be planning on doing, extra heavy yard work because you may not have total control of your muscles because they're more relaxed, so you might perceive some weakness. Right. So these are things that can all occur across the board, and any one of these muscle relaxants will cause all of those sides. So let's say I talk about metaxalone, I talk about methylcarbamol, I talk about diazepam, tizanidine, baclofen. They all have this side effect profile. So it's not just one. Right. And so when I speak to them, it's going to be a very generalized set of terms. Be careful because this is going to make you tired.
And as a physical therapist, I cannot tell you how many times I've had patients come in. They've seen the doctor prescribes the muscle relaxants oftentimes for back spasms. And that's their biggest complaint. I'm getting so tired. I just can't function. And then as a therapist, I'm thinking, well, did you try a cold pack? Did you try positioning? And I don't ask them that. I'm thinking that. Yep. So it's possible. And I think, I don't know if it's very possible, but there's good odds that there are options that a physical therapist could help you with. For example, cold pack with proper positioning of the body to reduce low back pain and back spasms can be very effective. And then you may not need the muscle relaxant.
And that's, I think that's the point that we need to touch on that's really important for everybody out there that uses these things is, a lot of times I see people because they come in an acute situation, I think doctors are just trying to treat the pain and move them on because they're in such a busy situation. Sure. I think, and I oftentimes at the consult and say, hey, if this doesn't seem to solve your problem in a couple of days, I would really ask your doctor about getting set up with physical therapy because they can recondition those muscles. They can get you back on your feet much faster than just relying on the drug alone. I mean, the studies do suggest that with or without treatment, the muscle will go back on its own, but the reality of it is you got pain, you got discomfort. People have busy lives. They don't have time to be down. So we give them these products to help them to get on their feet more quickly. But at the same time, probably the fastest mechanism to getting back to better is seeing a physical therapist to actually help to recondition that muscle and get it back to its natural state.
That's in our wheelhouse. All the modalities, the options, the way to treat it without medications, that's what we do.
And that's what's best, frankly.
The doctors really don't always have the time, and like you said, they may have 15 minutes and they may have
or less
10 more patients waiting for them, and the people want relief now.
And they do, and they're very good at judging what they need. And it's a triaged position. They come from a point of, well, I've got this bad person, this bad back or bad neck, or they were in a car, whatever, but they're going to do something that they can to help them to be more comfortable, and then let everything else settle out. And it's not because they don't want to take the time to, we could get you set up with Bob and Brad, or if you're a physical therapist of choice, And, it's something that a lot of times in passing they'll tell you, but sometimes they don't. And so I always mention it. And I also mention your website too, because you guys have such excellent do-it-yourself versions that certainly can give people some acute.
Goes directly into different
I use it as part of my consult with all my patients because I think the reality of it is that I think physical therapy is going to do more than a drug ever will. A drug is a Band-Aid, and it's the one thing that we see, and what I find very interesting and somewhat alarming, is that muscle relaxants, by their virtue, should only be used for up to 2 to 3 weeks at a time.
Okay.
44% of people that get prescribed a muscle relaxant are using it over a year.
You mean as a result of an acute injury, a back strain, injury from an accident?
Exactly.
And so do they adapt to it, or they just become?
You do adapt to it. I mean, it's just a tolerance develops to the side effects, and so our bodies are freakishly adaptable to just about any kind of substance, really, which is bizarre, but it's just something we do. We just kind of keep moving on.
Yeah, the human body is amazing.
It is, but the thing is that why would we put ourselves at adverse risk for side effects long term? I mean, I think the real message here is if you're not better, and I always tell people 5 to 7 days.
Sure.
But realistically, by medical guides, it's 2 to 3 weeks. Right. If they're not better, they really should be consulting physical therapy sources, because really we need to get those muscles healed. So we want you all back in the game. We don't want, or if you're not in the game, if you just want you feeling better, so you can go take a walk the dog, play with your grandkids, what have you, your children. Anybody can get hurt at any age.
Right. So, I really think, and for people out there, if you are going to see your doctor again, and maybe you are taking muscle relaxants right now, you're having the side effects that we've mentioned, and you want to get therapy, well, don't be shy to either call your doctor. A lot of times you can just call the doctor, talk to the doctor's nurse, and say, I'm interested in physical therapy. Can I get a script for it? And they're happy to do so.
They'll do the consult.
Sometimes they're not, but it never hurts to ask. A lot of doctors, say, boy, I'll do it,
Yeah.
And the therapists are happy to work with you. And then you can get off of those, and then you learn how to manage it with therapy means.
Exactly.
Which you can do independently at home.
Yeah, you can correct the problem so that it doesn't happen again.
Right.
And a lot of it's just simple, imbalances. It's just, you guys do such, there's always that balance. There's the antithesis, the pull and the push.
Yep. Right. Yep. And, postural problems, low back pain. Oftentimes I find people are sitting with poor posture and they're causing it, and it can be a simple fix. Not always.
No.
Back pain can be a tough one, but still, we want to get the, get things going in the right direction.
Yeah, because there's a lot of things too that, like things like fibromyalgia. That's chronic. That's forever. We don't have a cure for that. And so these people will need to use muscle relaxants long term. So I want to be very clear on that subject at least, because there are certain reasons. You have maybe a brain injury. You maybe have, something like cerebral palsy where we need to take these long term, and there may be some different muscle relaxants and things that they do, but they're coupled with therapy in a lot of cases all the time too, to try and help to give them the relief that they need. So,
and those people typically are working with a doctor long term as well.
No, they are long term. They are lifers really from that standpoint.
Right.
So
unfortunately, they haven't got that figured out yet.
Yep.
With
I wish we did.
Baclofen and baclofen pumps, and that's actually enough information for that. We can save that for another video.
We could actually do the baclofen one standalone, because that's actually a pretty fascinating drug.
So I don't, is there anything else that you want to cover over? I think we've covered
I think the big thing is drowsiness. The principle behind these drugs is it makes you tired and helps to relax the muscle. And that's what's going to hopefully help it to relax so that you can begin the healing process. But again, I think the takeaway is that, don't suffer. Don't wait too long to get care. If you got the opportunity to see a physical therapist, I encourage that very highly from the get, just simply because I think that's going to be the fastest way to actively recover, actively heal, and get you back in the game.
Right. All right. Thank you very much, Chris.
You're welcome.
And good job back there, Tanner. And, I'm very happy to be alive.
There you go. It's a good time to be alive.